Got a quorum?
Yes, Chair, 7 members.
Oh, good. There we go. Okay. Good evening, everybody. Hope you're all well. We've got several new faces in the audience tonight, so I thought it might be useful if we all introduced ourselves. Again, most of you know me. I'm Hazel Simmons, and I chair the Health and Wellbeing Board. So we'll go this way.
Good evening, Dr. Nina Pearson, GP at Lee Vale and Strategic Primary Care Workforce Lead for BLMK, and I'm Vice Chair for this board.
Over to you, Robin.
Hello all, Robin Porter. I've got the honour to be the Chief Exec for Luton Council.
Good evening, Sally Cartwright, Director of Public Health for Luton.
Good evening, everyone. My name is Mark Fowler. I'm the Corporate Director for Population and Wellbeing and also Deputy Chief Exec at Luton.
Good evening. I'm the Nikki Pullane. I'm the Chief Primary Care Officer for the Integrated Care Board and the Executive Link Director for Luton.
Hi everyone, I'm Steph. Oh, sorry.
Was it?
You go.
Yeah. Janice Altenor, Service Director for Quality and Improvement Children's Services. Thank you.
And end of day 2.
Yes. Thank you.
Sorry, I'm Jessica Kinghorn from NHS England. I've come to talk to one of the papers.
Richard Underwood, Chair of the HSCRG Health and Social Care Scrutiny Review Group for the Council.
Stephanie Simeon, I'm the Chief Executive at Citizens Advice Luton.
Good evening, Councillor Malik, Portfolio Holder, Public Health and Commissioning.
Good evening, James Ramsey, one of the Deputy Medical Directors for Bedfordshire Hospitals and the Clinical Lead and SRO for Cancer across BLMK.
Good evening, Michelle Bradley, Director for After Mental Health and Learning Disability Services.
Hi, I'm Lucy Nicholson. I'm Chief Executive of Health Watch Luton.
Phil Turner, I'm Chair of Health Watch Luton.
Councillor Tamina Salim, I'm Portfolio Holder for Children's Services at Luton.
Hi, sorry, I'm sitting in the wrong place. We just to sort that out. I'm Fatima Begum, Portfolio Holder for Adult Social Care.
My name is Aziz Ambia. I'm the Conservative Councillor from Birmingham Ward.
Yeah, thank you, Chair. Hi, everyone. I'm Councillor Lee Bridgen, and I'm the Chair of the Scrutiny Children's Services Review Group.
Good evening, Marie Lowe, Democracy and Scrutiny Officer. Thank you.
Sorry. Oh, sorry. I beg your pardon. Oh, is Diraj online? Oh, sorry. Hello, Diraj. Sorry, I missed you. Do you want to introduce yourself?
Will do. Good evening, everybody. I'm Dhir Chiba. I'm the Corporate Director for Children, Families and Education at Luton Borough Council.
Sorry about that.
There's somebody else online.
Is there a second person? No.
Right.
Okay. Have we any apologies?
Thank you, Chair. We've got apologies from Ian Howarth from the Bedfordshire Fire and Rescue Service, David Carter from the Bedfordshire Hospitals NHS Foundation Trust. That's all. Thanks, Chair.
Okay, thank you. Minutes are before us. I'll take them page by page if anybody's got any questions on us. Page 5, 6. Have you all got the minutes? 7, 8, 9, 10, 11, and 12. Can I sign them as a true record? Thank you. Remind members of any disclosures of interest this evening. And we have no urgent business under item 4. And as far as I can see, no references from any other committees. No. So we're moving straight on to the agenda and item 6, and it's improving cancer outcomes in Luton. So I think we're over to yourself.
So thank you. So the paper submitted gives an update to the board about the work that we've been doing to address poor outcomes that we've observed for patients diagnosed with cancer in the Luton population. So the primary ambitions of the cancer long-term plan are to improve 5-year survival and to ensure increased diagnosis of cancer at stage 1 and stage 2, where treatment options are much better. So our work started in 2021, and it was to address some of the long-standing concerns around the poor health outcomes observed for Luton residents following a diagnosis of lung cancer, and it was identified that we were a national outlier. So a group of multiple stakeholders came together and we looked at a number of issues to try and identify what the contributory factors were that were driving that observation. And I want to say that we're incredibly proud of the work that we've been doing and the work we continue to do and the impact that we are starting to see following the implementation. So the main conclusions of our findings were that we are seeing an increased number of patients diagnosed with cancer. The latest data set from 2018 revealed a disappointing reduction in the numbers of patients being diagnosed with stage 1 or 2 disease. The ambition, as I cited earlier, is 75%. We were seeing only 57.7% for the Luton population. We identified that the contributory factors are broad and they incorporate and include health inequalities, which impacts on patients' presentation, engagement with services and treatments. And what we've identified through a review of cancer tracking is a lot of patients DNA the appointments that they've got with the healthcare providers. We also identified that there is a significant opportunity to improve screening uptake, and we've identified a number of barriers to the uptake of those screening offers, and they are quite different for different tumour sites. And then finally, what we've identified is that the provision and access to services can impact on the treatment uptake. And so we wanted to address the access to services for the patients in Luton. So through the programme, we established 4 working groups. The first was to look at primary care and screening. The second was looking at diagnosis, treatments and access to healthcare. The third focused on the wider determinants of health and the prevention agenda. And then the 4th work stream looked at improving community engagement. So some of the improvements that we've seen following the implementation of the working groups is the development of dashboards, looking at uptake into screening programmes and referral into cancer pathways from primary care across our region. We've been seeing an increase in uptake into screening, and we've also been monitoring quite closely the uptake of radiotherapy as treatment to see whether we need to improve services to enable better transport for patients to access those treatments. We've implemented a transport scheme to optimise that, and we've been doing a lot of work with our communities to look at how we can raise awareness regarding the signs and symptoms, and that's both across the citizens of Luton but also across our healthcare groups as well. We've done some case finding, looking for patients with prostate cancer who have been at high risk, but not necessarily symptomatic. And through that programme, we've had support and engagement with 2 of our PCNs. We're hoping to roll it out across the remaining 3 in Luton. And through that, we've been identifying patients at a much earlier stage with prostate cancer, even asymptomatic men. We've implemented workforce training regarding the importance of health inequalities. And we've also been doing education in our local schools regarding cancer awareness. And then finally, we've developed an experience hub, and that's to try and capture some of the experience of patients that have been diagnosed to see how we can use their experience to further influence our service provision. We've employed community connectors to work with 3 communities that have been identified through the Luton Outcomes work to not always engage with the services, and that's particularly our African and Afro-Caribbean populations, our Southeast Asian and our Eastern Europeans. So we've got community connectors working specifically with those 3 community groups. We've developed the transport scheme to enable patients to access treatments that are delivered on the Mount Vernon site. We've developed an easy read summary report which helps communicate the findings to the local population, but also others across the community. I'm really proud to say that our head of cancer, Kathy Nelson, who's been intrinsic in this work, was awarded a Best Researcher at the BAME Health and Care Awards in 2023. And as I've highlighted, we're already identifying cancers in high-risk men from prostate cancer. So following the implementation, what has changed? We've seen the number of or percentage of deaths due to cancer fall from 25% to 19%. We've got evidence of improved GP awareness through our clinical conversations and also through the risk factor and awareness campaigns for prostate cancer. We've implemented the targeted lung health checks, which is a screening programme for people at risk of lung cancer, and that is successfully diagnosing patients with cancer. And through that programme, 80% of people diagnosed are at stage 1 and 2, which is a significant shift for where we normally see patients presenting with lung cancer. We identify that there are significant barriers both within staff and also with our population to discussing cancer. It remains an issue that we want to address. We've got a whole rolling programme with our community connectors to do listening events and work with the communities promoting symptoms and signs and education regarding cancer. And then what we've also seen is an increase in the number of patients referred into secondary care through suspected cancer pathways. And that has been something historically quite low in Luton, so that's really positive. And then finally, what are our next steps? So we want to further work with our public health colleagues, and we're developing dashboards which can identify the uptake of screening and referral into secondary care across GP practices and help to support and target where we see outlier activity. We want to develop a cancer health needs assessment. We want to look at how we can embed some of the behaviour change to try and influence better decision making regarding health decisions. We've rolled out a barbershop a barbershop event where we invite communities, and we're going to be rolling that out to the South Asian communities. And then we want to continue working with the University of Bedfordshire to evaluate our project. And finally, whilst we presented the paper, and we want you to note the updates and support the work as we move into the continuing phase, I think we recognise that within the audience, we've got people who are subject matter experts with working with their communities, and we really want you to help support the messages that we're going to be delivering and help us give the messages to the communities that you're working with. Thank you, and I'm happy to take any questions.
Thank you very much for that. I'll open it up to questions. Yes, Phil.
Sorry, just clarification, James. You said 25% of deaths down to 19. Was that of all deaths?
So yes, that's all deaths. So we've seen a reduction from 25% attributed to cancer down to 19%. There's probably other factors at play, not just this, but it's certainly a good promising statistic.
Yeah, just a couple of bits for me. I mean, one, and I understand the data lag, but it's really disappointing, isn't it, that, you know, in 0.17, 2018 numbers compared to where we are. And I know that's just how we fight against that, but I always feel like we're trying to piece together the information. There's some really good stuff around the screening, up to the 60%, which is really positive. I just wonder whether we compare to other authorities and other areas, or it's probably a better way. But it's a question when I've got a couple to come back on.
So we see huge variation actually with regard to the uptake into screening programs, and that's variable across communities, but also across the actual screening programs and their acceptance. We've seen historically low uptake in cervical screening. We've explored the barriers, and we try to address some of those to help support increased uptake. Within the lung health check, as an example, we see uptake figures ranging from about 30% up to nearly 50%. And again, that is dependent on community. And so we secured some money through the health inequalities to actually try and understand what was driving that, so that we could evolve our programme as we move forward, because we want to try and capture those most at need. So in terms of how do we compare against peers, it's very similar.
So the 60% is Luton and Bedford are comparable. Okay, so that's interesting. On the point around communities, that's really helpful and heartening to hear about the engagement and improvement in that space. Is there more that you talk about people in the room, and I completely agree with you. What would be your specific ask to the people here to support, and what could we do to actually share that? And just from a point of reference, it'd be lovely to see how much work we did last year and what we're doing into this year, to see if there's an increase year on year of what we're doing in that space.
So I think the ask is really to promote the messaging, to try and increase the awareness regarding symptoms and signs, but even some of the more simple things like actually it's okay to talk about cancer, and almost normalise that conversation, because there are certainly some communities where it's really quite difficult to engage and even start that conversation.
And just thinking about, I mean, do we do any specific work with faith groups, faith leaders, just to get that across?
Yeah, so we've tried to look at who are sort of like community leads within the local population and tap into them to try and use them as influencers to again get those messages across.
Hi, it's Lucy from Health Watch.
Mark, you asked the questions I was going to ask, but just to say, yeah, it's the community connectors are brilliant, and clearly the results. And I think for me, what's inspiring is you're looking upstream as much as anything. So my question is, how much more should we be doing as a local authority to to advise around lifestyle changes at a younger age. So I'm thinking, you know, we're talking, I think generally it's usually adults that present with cancer, not always, but oftentimes obesity in childhood is a bit of a ticking time bomb. And the ward certainly that I represent, it's 40% obesity in year 6. So we need to kind of think about children and their lifestyle and how can we as a local authority, I know we're doing a lot, but I'm sure that you would want us to continue with that work and look and deep dive, because it's all interconnected. It's not just obesity. Obesity has got, you know, implications for health, and it's about changing lifestyle as early as possible.
Yeah, and certainly one of the work streams is specifically looking at the prevention agenda. So we're working with our public health colleagues. We're addressing things like smoking cessation, reducing alcohol consumption, but also that obesity issue. And you raise that point that, you know, the statistics are getting ever increasingly more worrying, that, you know, 40% of young children are now obese, and we know that there is a link with obesity and cancer, and we need to be planning for what the future might look like based on what we are already seeing in the population with regard to obesity, because that might translate into higher cases. So we need to plan our services based on that.
I mean, essentially, if you can see a car crash coming, you try to avoid it. So I think what I'm trying to get at is we need to do a lot more within communities, within the local authority, to look at what's coming along. And I think obesity is for us a big red flag. And I know that we're doing so much, but I think it needs to be borne in mind that it is connected to cancer and other health-related outcomes, isn't it?
Absolutely. So if you can influence on things like smoking cessation, alcohol consumption, healthy eating, exercise, and those lifestyle choices, that's really, really important from health messaging. Thank you.
I was next. Just 4 points to make. So first off, I think we can all recognise that the cancer system across the patch wasn't where it needed to be. 25% to 19%, I think, is a massive improvement. And second point, from a personal point of view, I can just attest to the absolutely fantastic work that James and his team are doing. So thank you. Third point is to mention that the ICB has just completed, relatively recently, a 2040 pledge, which is now on the Luton 2040 website for people to see. And it's got a number of parts in there that the ICB has committed to do, which will contribute first to ensure that cancer pathways are accessible and that we reduce the proportion of people presenting with a late stage cancer. Also that we're going to campaign to NHS England to secure funding for a clinical diagnostic centre in Luton Town Centre. It is criminal that we don't have a clinical diagnostic centre in Luton. And then additionally, that we're going to advocate to deliver a radiotherapy bunker at the L&D as well, which all positively contributes to furthering the agenda.
Thank you.
Thank you. So overall, absolutely support all the work. I sit on a couple of the programmes and all the team are massively motivated and passionate, and it's really great that you can see results. I think from an insight perspective, I think Healthwatch can support. The network is doing a review of cervical screening and cancer screening. So to understand those barriers, they're pulling that all together now. So that might be helpful to form some of them. As from Healthwatch Luton's perspective, we're working with particular groups of women for the Women's Network programmes, but there's particular groups around FGM that are highlighting particular barriers to all health and social care, let alone screening. I just wondered if there was an aspect of all this work that was linked into particularly the community connectors or the cancer connectors, sorry, that could do stuff around research and clinical trials. So they're going out and talking to them about that. So whilst we're talking to the community about symptoms and management, but also to take part in potential research trials. That was it.
So I think there would be an opportunity. We have linked in with the University of Bedfordshire. They're going to be formally assessing the programme and also formally assessing the impact that those community connectors are having. And so that would obviously, through that link, look at the potential opportunities that there could be to explore research opportunities moving forwards. Thank you.
Thank you. This is a great paper and lots of positives in here. I think I'd like to know a little bit more, either in the future or if you've got some answers now, as to the reasons people DNA their appointments. So they're already on a pathway, but they DNA at some point in the pathway, because there could be some transferable knowledge that will help with other pathways as well. So that would be really helpful to get into at some point. We've talked on here about referrals for urgent suspected cancer have increased. And on here it says GPs are more aware of signs and symptoms, but I would also like to add in that actually, because the model of delivery has changed, and we're trying to ensure the individuals consult with the person most appropriate to move their management forward, I think that's increased the capacity and increased the access and the speed with which decision making is made, and hence means that more referrals are going through. So let's not miss the opportunity to recognise how the model of delivery is helping with this, because too often we hear about what's not happening in general practice, and I think that's a key enabler in making sure that people get further on in their pathway in a more timely way. And if we could do some research to prove that, that would be even better. But instinct tells me that that's what's happening in our achievement of those higher referral rates.
So anecdotally, I can talk about some of the issues that are contributing to DNA rates when people are on cancer pathways, because we've been doing an intensive piece of work following the performance against cancer waiting time standards through Bedfordshire hospitals, particularly on the Luton site. A lot of our citizens are from ethnic diverse groups and are often out of the country, even though they've been referred into a cancer pathway. And so trying to get them to come to their appointments can be difficult. We've got mental health issues which impact and access issues around the wider determinants. So people will have competing priorities that are, in their life, and actually coming to see a doctor with a suspicion of something as serious as cancer doesn't take their priority. We have secured some funding to actually look at this in more detail, to actually identify what are the contributory factors, what can we do to overcome some of them, like reminders, making sure that people know that their appointments are taking place, and is there anything from an access perspective that we can do to support. So there's work ongoing in that area.
Kashita.
Thank you. I welcome the report, and I think it's amazing work. I've worked with the community connectors as well, but somebody who's most recently, when I look at the figures, it's really welcoming. But somebody who's lost quite family members, close family friends, even this week, last week. To me, it seems like all I ever hear about is somebody's got cancer and it's at the end stage, and then you hear that they passed away. Haven't really seen anybody. I think I've got one child, immediate family member, who's been diagnosed recently, and it's the only one that I've seen that's actually having treatment, and it looks positive. So for myself personally, I agree, the stats are there, so you can see the reduction. But if I look at it as a personal thing, it seems like it's just increasing. So I mean, the early detection for me is really, really important to make sure that communities do know. Obviously, all of these people are from my own community. So, you know, it's really important for all communities to understand what are the signs and symptoms for them to be able to get that support early on. And speaking to some of the families, when you do go, there is a level of who to contact, and that we've done that, and how long do we wait because we haven't had our appointment. So I think I'm sure you touch on all of that comes out in that, but it's really sad to still see that people are being diagnosed in that early stages, and then you just hear that they've been given maybe 10 years and they've gone within a year. So it's really, really sad. So this is something that really touches me, because I probably in the last year or two have lost a lot of family members. In the last week, I think I've heard of at least 2 people that I closely know, and I've lost about 3 people that have died to cancer in Luton. So it's really, really sad that we still in this day and age are still looking at those inequalities, and we still not being able to see those numbers close to me, you know. So it's just all of a sudden and it's gone. So I welcome the fact that we've got these numbers going down. And I think I was going to get onto the trials bit that Lucy touched on there. You know, what is it that we can really encourage people to come forward on these trials and see that we can get some of that treatment for them. Thank you.
I think you've raised a really important point there, and that is people's lived experience of cancer, and it's commonly a negative view. And actually what we're probably not very good at is articulating some of the better outcomes that we see with cancer. And actually that's maybe something that we as a group need to start to focus on. And if we share some of those positive stories with good outcomes, it might actually encourage people to come forward more, because I think it's that nihilism that you're talking about which really makes people disengage and not want to talk about cancer. So I think that's really important, and I'll take that back to the group.
Fatima.
I think it's been covered. My question has been covered. The only I do have a comment. For once, I like this report. Thank you. Very clear for me to understand, and it's really good to see the community engagement, which we don't see most times in the report. The one thing I would have liked to see about chewing tobacco, if we were doing anything, this could be for Sally as well. We know chewing tobacco causes cancer, mouth cancer, particularly in South Asian communities. So it would have been good to see if we're doing any work around that.
I'm really sorry I didn't catch the question.
Chewing tobacco, which causes mouth cancer, if there's any work around that.
So we certainly identify that chewing tobacco and betel nut increases the risk of mouth cancer. We've identified through the head and neck team that they've got some specific issues around, again, engagement and some of the psychological issues that some of those patients have. So I'll talk to the head and neck team to see, because we're also looking at some additional funding to try and put some additional psychological support into that particular group.
Sally.
Thank you. And my question can touch on that last point a little as well, and I can take it away just to talk to the team about. So obviously really supportive, and my team's working closely with James and Kathy on this. I just wanted to make a couple of points. One is around the data dashboard that was mentioned. So we're working collaboratively on trying to get that data to make sense and show outcomes, because what we're finding in some of the data now is at BLMK level, and trying to extrapolate it down for screening is a bit more tricky. So we really want to be able, there's so much great work, it's quite difficult to say, and what difference is it making at this point? So we're working on that data dashboard. And I just wanted to make reference to the population wellbeing strategy that's coming through, because it just is a good example of where, for the high level population wellbeing strategy indicators, we've got some top line ones, and then underneath for each of the big work programmes, we want to go into this sort of data dashboard approach. So cancer is a really good example. We're talking about it for mental health as well. So some of that granularity of some of the work programmes we'll be able to unpick through that approach. I then also just wanted to make a point on some of the prevention work. So obviously all of the pieces that have been mentioned around weight management, tobacco, etc. We're doing a lot in that space, and it feeds in and is connected. And one of them that particularly we're working on connecting better, and we have a real opportunity next year, is on the tobacco agenda, because we've got some additional funding coming down through the National Smoke-Free Generation work. So we've got some additional funding that not quite over the line yet, but we're working up our plans on how we're going to spend that funding, and we want to work with the model that the Macmillan Cancer Connectors have been building on around reaching out to some of those communities. So thinking about Eastern European, South Asian and Black African, Black Caribbean, but using that network that they are building and bolstering it through the stop smoking work as well. So building in stop smoking into those conversations in a bit more, in a stronger way. So that South Asian link, I was just thinking in response to your question, Fatima, we can start thinking about actually what's the conversation there around chewing tobacco as well, because it might be picked up, but I don't think we've really covered that very much as yet. So I'll take that back to Suleiman and the team.
So I want to highlight the work that we're doing with public health around the dashboards. I think it is so important because it really gives us a data set where we can start to focus some additional attention on areas that might be struggling because of the community or because of other issues. And it's how do we turn that data and translate it into something that helps support improving what we see. The other thing I'd just highlight, I was aware that money is coming down for smoking cessation and that agenda. I think what we've seen through the lung health check programme, because we will be offering smoking cessation to current smokers that we invite, the success rate, I'm led to believe, is higher in that group. And actually, it might be something, if you've got a limited resource, where you might want to look at channeling that funding to that group, because I think it's a target audience where the success rate, I think, has been shown to be higher.
Okay, thank you. Are there any other questions from anybody? Yes, sorry, Stephanie.
Michael, oh, there we go. Sally was talking about data, and you've talked about communities and, you know, like different demographics in Luton. Do you look at ward data in specific to see what areas in Luton have got higher rates of people, you know, accessing services and those types of indicators?
Yeah, absolutely. And that's all been built into those dashboards that we've been talking about with public health.
Yeah, because we're starting this new GP surgery outreach advice, it's the Citizens Advice initiative, and we just want to make sure that we go into the right places, the right wards, that actually, you know, people need our help. So it'd be good to actually see some of that data, and we're working with the PCNs as well. So if I can have a look at that, it'd be great.
So we presented this at the last cancer board last week, and it got recognition from the regional team as, you know, a really good piece of work. So, you know, the work that we're doing is being recognised both regionally and, as I said earlier, nationally, with Kathy winning her BAME award, which was fantastic.
Well, thank you very much. Unless there's any other questions, is that you, Mark? Did I? Yeah. Okay, Nikki.
Yeah, no, I was patient. I just wanted to make a link. So James mentioned about the work stream for primary care. I just really want to emphasise the engagement of local dentists about the chewing tobacco. That is something they're really working on. And obviously, Kathy Nelson works incredibly closely. So community pharmacists and opticians, and not only just the prevention, which is a challenge in itself, but it's actually raising that awareness of helping people to seek help when they've actually identified some of those early symptoms. So some of that is the work We've called it the primary care contribution. So it's all of those primary care providers. And exactly as what James was saying, it's about that linking with public health. It's how we do it together. And I know that we've done the work with Health Watch in the same way. It's about how you've got that consistent messaging out. And I think the other thing I was going to say is that it was a forum that I think it was part of one of the Marmot workshops about reframing the question. So, and I just think that's so powerful. I know we've got something working on that, and it's about how we work with the communities to make it in a way that engages them and not frightens them.
A really quick point, Hazel. Firstly, James, it'd be good. I think Steph's question is a really interesting one about what we could share with this group. Because actually, if we're informed, we can do something good in on the community network stuff that we're trying to embed as well. So if we could do that off the back of this meeting, that would be really helpful. And just again, this is probably more example, but bringing on Nikki's point, I think there's something about designing who designs those engagement pieces of work. And actually, is that the Black African, Caribbean, is it the Eastern Europeans? Because actually, if it's being designed by people, it gets to your point of framing the question differently in a way people understand and feel included. So just points. Yeah.
Still a lot of work to done, but good start. Yes. Yeah. And we'd like to, if any way the Health and Wellbeing Board can work with you on anything, please do keep us informed, because I'm sure we would all want to do that. Yeah. Thank you very much. Hear me. Atolic Bar online? Sorry. Atif. Sorry.
Yes, I'm here. Yeah.
Yeah, sorry.
So should I introduce?
Yeah,
Hazel?
do you want to introduce?
So
it?
yeah, I'll just so Kate was going to present this item, but she's unfortunately off sick. So Atif has kindly stepped in just to support. He's our finance business partner, but works really closely with us around working through how to spend the money basically for the Better Care Fund. So there's two papers. One is the plans for next year and beyond, which we've been working through really closely, and Atif can talk to. And the other one is the Q3 report, which is relatively straightforward and is for sign off here. It's come through on a number of occasions, and there's no major changes to what we've presented previously. The next year's the big risk, and Atif can talk to this in a second, is around the hospital discharge and the continuity of that. But we have worked through with the Joint Strategic Commissioning Group and finance groups around how best to manage that risk and how best to manage the spend and plan for that. So Atif, are you happy to talk to anything else from your perspective?
Yeah, sure. So sorry, I'm in my car. I'm just waiting for my kids to come out, so apologies for that. So very quickly, so the first report is about 24-25 BCF, as Sally just informed. Now, if you remember, this was supposed to be for 2 years. Last year, we actually presented this. The BCF was supposed to be for 2 years, 23-24 and 24-25, and this report just confirming that position for the second year, which is obviously 24-25. This aligns with our budget setting process of the council as well, which is we're now going through various committees, obviously, and it's going to be presented in the full council on the 19th next week as well. So just to confirm, BCF, we've been informed and confirmed by the ICB the increase uplifts for the next year in BCF, which is 5.6%, and that has been built in the total expenditure and agreed at JSCG level, so agreed at the finance subgroup and JSCG level as well. Like previous years, the majority of the BCF is obviously already committed. There are few projects which are looked at by both the council and the ICB and agreed on. So those projects are continuing in 24-25 as well. Apart from that, we linked. There's some mention about the hospital discharge, as Sally mentioned as well. So because of the hospital discharge grant which has been received both by the council and ICB for next year, we are continuing with the hospital discharge pathway for the next year, 24-25. Within the BCF, any unallocated amount, any underspends are being ring-fenced, and they are used towards the hospital discharge gap, because there was a gap when we started looking at the hospital discharge pathway for the next financial year. With the really good work between the council and ICB, we have managed to reduce that gap, and we should be able to achieve a position within the hospital discharge and BCF for next year. However, as Sally mentioned, there is a greater risk for the 25-26, the year after, because we haven't received any confirmation for the hospital discharge grant to continue, and ICB haven't received either. So that is something we're looking at. We have put a project team together, and we're looking at all the associated risk with that in 25-26 onwards. So that was the first report about 24-25 and the link with the hospital discharge. Any questions on that?
I hope I'm on the right page here and with you on this. I was a bit unclear as to why there was an unallocated 565,000 in the hospital discharge grant. Because given that we're always scratching around for money, I was a bit surprised that there was £500,000 not allocated. It's on page 23 of the report.
Okay, let me just have a quick look.
It's going to be taken, it says it's going to be taken forward from 23-24 into 24-25. But to say, there's so many schemes where we would really like to find some money to be able to happen. Just wondering whether it can be applied more liberally to other things, or is it very tightly ring fenced and too many restrictions on what it can be used for? And maybe you need to find it later, but it's just a query I've got really, and you can come back to me afterwards.
No, I can confirm that now. So basically, when we looked at 24-25 hospital discharge, the actual expenditure wasn't covered by the available grant, and at that time, we had ring-fenced any underspends, any unallocated amount in 23-24 hospital discharge, which is the current financial year. Now, because there's been some efficiency made in the next year plan now, which is making the actual 24-25 allocation for next year and the expenditure balanced, there might be some of these monies available now by the end of next year. But as I said before as well, because we have got no surety of any of this funding to continue beyond 24-25, the agreement or the understanding between local authority and ICB is that any underspends within this year or next year within these grants will be ring fenced to offset any of those risks going forward. Sorry, it's gone dark in my car. Just trying to turn the light on.
Allocations. Is everyone okay? That's in the report here. Yeah. Yeah. Thank you. You want to move on to the second report, Atif?
Yep. Sure. So the next report is just giving an update on the 23-24 position on the BCF. And basically it's just confirming the position which we started the BCF with. So there is no variances actually reported within the BCF. I mean, BCF is actually divided obviously between ICB and the council, and if there's any variances, we actually agree. We agree between the two organizations and find a solution for that. The only thing obviously is the unallocated amount. It goes back to what I was actually explaining before as well. So we had ring fenced in small amount of unallocated amount from this year's BCF as well, just to offset that financial risk of the hospital discharge grant for the next financial year. So just to reiterate my point, any unallocated within the BCF for 23-24, 24-25, and the hospital discharge unallocated is being ring fenced to offset the pressures we are seeing in the hospital discharge for next year. And that's the reason there are some variances in there. Apart from that, there isn't anything which needs to be mentioned in Q3 report for the BCF.
Thank you very much. Are there any questions? No, everyone okay with that, and everybody happy to approve the Q3? Okay.
That's great. Thank you very much.
Thank you very much. Thank you.
Thanks. Bye-bye.
We now move on to the child-friendly town update. And who's doing that tonight? We've got Lisa Hudson online.
And I'll open it, Chair. Thank you.
Thank you.
So good evening, everyone. The report's been presented to Health and Wellbeing Board. As you know, becoming a child-friendly town is one of our 5 priorities within Luton 2040. And the priority is, as you know, where our children grow up happy, healthy, secure, with a voice that matters and opportunities they need to thrive. We know that this priority cannot sit alone, and no one of these priorities can be achieved without the others progressing. However, in order to achieve this outcome, we've got a range of work going on across children, families and education, across the council as well as with partner agencies across the borough. I was at the Luton 2040 conference last week, as were a number of you I know in the room, and we heard about the great progress being made in a number of key areas. So some of those included improvements of our schools in education attainment, growing percentage of our schools graded good and outstanding. We have reducing numbers of children not in education, employment and training. Our work across the safeguarding landscape, which of course seeks to achieve the safety and security element of our priority. And a particular element of this priority relates to our work with UNICEF and achieving an accreditation towards being recognised as a child-friendly town. So this paper sets out where we are, what we need to do next, and the ask of Health and Wellbeing Board. And with that in mind, I'm going to hand over to Lisa Hudson, who's the project lead for Child Friendly.
Thank you. Thanks, Dheeraj, and thank you everyone for having me. It's really great to give you an update around Child Friendly. So I'll take it that you've all read the report and gone through it. So just to pick out some highlights. So from the 16th of July last year, we were able to repurpose my own role and dedicate myself to the full-time role of Child Friendly and coordinate that. So we're starting to see some sort of progress moving forward. Dheeraj has already explained to you what the purpose of that, so feeling happy, healthy, secure, voice that matters, and what really importantly, and the opportunities our children and young people need to thrive. So if I get to where we are now, we're sort of at a point where we've got the UNICEF Memorandum of Understanding, or the contract, however you want to describe it, is between our 2 legal departments at the moment being worked through, and we hope to be working with them quite shortly. When we do commence work with them, it will be about delivering a child's rights rights approach training, and also some engagement training across the town, so that we start to follow that rights-based approach and underpin everything that we do and our policy. So there will be a requirement there for Luton Borough Council in particular to look at their own policies as well, from a point of view of that child's rights, and to look at if that actually sits in their policy, and if it doesn't, then my understanding is that UNICEF will be looking for us to review those policies. So we're going to be so what I have done to date already is worked with multiple partners and started to prepare them for UNICEF coming on board. I'm really pleased to say I've met over 40 different partners, agencies and teams and departments, and had a conversation with them about child rights training and about child-friendly activity and what that might look like for them and their organisations and how they might want to get involved. And all have expressed their commitment to attend that child's rights training, to take on board the child's rights impact assessments, which is really going to be important, and again especially for Luton Council in our decision-making process. And they're all keen to get involved and sort of continue to hear updates and support wherever they can. In particular, we had a schools student council conference back in 14th of December, a really great event, but it's a real great example as well well of how the system work partnership is working at its best. So looking at, the engagement and participation officers and experts from across our partners. So we had Active Luton, we had our climate change colleagues, we had our public health colleagues, we had youth participation, we had colleagues from Children's, Families and Education, we had Cambridge Community Services, we had our engagement experts from the ICS and CAMH, and also Luton 2040 leads as well, and our schools, all working together to bring that conference to fruition. You've got a copy of the evaluation of that particular conference, and it was really heartening to hear that 91% of students said that they felt listened to by their schools. However, only 29% of those students felt listened to by people who make decisions about their town. So I kind of feel that there's a big area of improvement that we'd like to see by the next, we hope to have these student conferences on an annual basis. And I hope by next year we're going to start to see some improvement, as I already know there's so many different departments across our own council, but across our multi-agency partners as well, and from all the different organisations that you members represent, that actually everyone is starting to ask about where that child and young person voice is coming from in their own decision making, which is absolutely, it's music to my ears, and certainly I think it will help us towards that recognition a little bit quicker when we get on board with UNICEF. Children and young people actually told us that they want to see more, what they wanted to see more or less of, and what was the best and worst things about their town. And again, if you want to read about that, that's in the document. They did say that they want to stop talking about the worst aspects of living in Luton and instead concentrate on the best ones and how they improve those. And they wanted to be part of the solution, and they want to get involved in our Luton 2040 journey. And really interestingly, the challenges that we face in Luton and our citizens face in Luton that they did identify, very much they linked that and were able to link that themselves to the Luton 2040 and poverty, and how poverty is at the the crux of that, which was really heartening and quite insightful from our young people, which was absolutely fantastic. So we hope that our future feedback to our children and Hazel and Robin, I hope very much that you will be able to, give some sort of guidance to our children and young people of what they've said from that conference, and what we are going to do as a town or a council in response to that. So I hope to work with you on something on that, so that we can give that response to them. And again, at each future student council conference, we hope to do a You Said We Did, so that they're getting that feedback loop. It was really highlighted by UNICEF, the importance of that feedback loop. And again, I'm not too sure if we do that enough. I know we were talking about child obesity in year 6, but we have made great movements in child obesity in our year R. So but I've not heard much about that just lately, and I think that improvement needs to be shouted about, and maybe we need to do a bit more of that. Anyway, that's me digressing. So work with schools, we need to build on the schools councils by linking them into the neighbourhoods, and providing children and young people to have a say on where they live and where they go to school. And we also highlighted the need for perhaps a collective town-wide system where that voice of children and young people can be captured and shared, recognising that actually a lot of the surveys that we've done with our children and young people of late, there are some definite common themes that are coming through. And we need to be making sure that our children know that we are listening to them, and we heard them at that conference and didn't ignore it when we asked them from another survey about something different. So kind of where are we now? So we've got the strategic board that meets every 6 weeks. We go to the trust board, Children's Trust Board, every 12 weeks. And at the strategic board, we now have youth council representation, which is absolutely brilliant. And that's fantastic. from the Luton 2040 conference that's just gone. You will probably, if you were there, you will absolutely remember the young lady from Sixth Form College who had an awful lot to say. Well, she is quite keen to come on to either or and both our strategic board and also our champions group, which is a group of high-level leaders influencing that progress. And again, they met for the first time this year, so that was fantastic. Like I said, we've got the MOU in our legal department, and we've got some great things coming on board. We're going to be working with the Royal Opera House and bringing some child's rights type training to at least 15 schools, where they will have the opportunity to understand a little bit more about child's rights and about their rights in the world that they live in through the medium of dance, choreography and song. And there will be a live stream. So I don't know if you've had a look at the link that I've put in the paper. If you do manage to have a look at the link, go to the video that's there. Absolutely inspirational, and I can't wait to see the response from our children and young people when they get involved in that, which is great. I've popped in the document there just to keep you on board about the UNICEF. So Cardiff have actually become the UK's first UNICEF child-friendly city, and I'm hoping that we will be the first in England. So yeah, we're a bit late to the game, but let's hope we can get there. Our next key steps for sort of in particular is about, we talk. You sort of mentioned about cash and resources being an issue in previous comments. It's very much an issue here too. So it's about attracting investment and sponsorship and how we do that. We're going to now start to put a clear indication of what it is we're going to be looking to deliver and what that might look like. It's quite difficult at the moment because we are going to be going into this consultation discovery phase, and until we understand what badges and priorities our town wants to work towards, it can be quite difficult to appreciate what areas we need to and what we actually specifically need to do. However, from what we're hearing from our children and young people in all different formats, I'm starting to get a picture of what I think those badges and priorities are likely to be, which is quite insightful as well, and it will be quite interesting if that comes through. So yeah, we've got the child's rights training, child's rights impact assessments, capturing child and youth voice in all we do, and I'm hearing more and more people talk about that and how they're achieving that, which is like I said, music to my ears. We're looking for organisations and businesses and individuals to make that pledge and commitment to not only Luton 2040 but also to child friendly, and trying to get them to think about the child's rights and that child voice and child's rights impact assessment in that pledge and when they're doing that. We've got an engagement strategy that is nearly over the line. It's co-produced and is nearly there, so that will be great. We have disseminated the Students' Council Conference evaluation report, like I said, which you've got a copy of here. And yeah, we continue to think about the mechanisms that we can do as a town-wide system. It's no good for just us in Child Friendly to think about how we capture the voice of our children and youth. It needs to be something that we can all collectively get involved in and we can all share and benefit from. So yeah, I guess over to you, just to say that the generosity of our partners, a huge thank you. I don't know exactly who's in the chamber there today and in the room, but without that generosity, a University of Bedfordshire gave up their load of space for us and their time, and students were there as well. So absolutely fantastic on that conference, and it's through that generosity that Child Friendly Luton is being delivered at the moment. So yeah, any questions really?
Thank you very much for the full report there. Are there any questions for anybody? None at all? Yes, Nina.
Thank you, Lisa. And it's really great report to read. A lot of detail in here. I was just wondering, have you got a brief report that we could perhaps take into clinical directors meeting, because I think this is an example of where we could be focusing on integrated working. What does that mean around the focus of the child? So it's something that I will seek from my colleagues, a willingness to sort of embrace this, but we'd need to have a very brief overview to put into a much shorter meeting.
Nina, we'll have a one-page report delivered.
Brief never is my kind of forte, really, but yeah, I absolutely will deliver that for you. So yeah, one page, and is that to you then? Yeah, absolutely.
Thank you very much.
Yeah,
it's a positive. Anybody else? Lucy.
Hi Lisa, it's Lucy from Health Watch.
Hi Lucy.
Hello. I think, listing out all the multi-agency partners that have been involved, I think it's just a real great display of partnership and collaboration working prior to you set forth any programme of work. I don't think this is quite rare to see, so it's really great to see. I just wanted to highlight, in 2019, Health Watch did an event in the town with the police and safeguarding. I can see safeguarding officers are part of your agency meetup. But the young people at that point were telling us that the most important thing that they wanted in Luton was to feel safe and to feel involved. So I get this part of the programme is really moving towards being involved. There's a lot of work going on there. But if you look through their comments and their feedback, the feeling safe element is still there as quite a highlighted part. And I understand that all these programmes feed into each other, but I couldn't see in this report how it did interlink with town development, how the police are involved in that support. There's a lot of understanding about children's rights, which I get, but what else can we do to really clear off that section of children feeling safe and they're in a town where they can go out and about? If you look at all their responses, it's quite horrifying, I think, for children to be listing gangs and drugs and crime.
Yeah, and killing even is just, it's not right, is it? Absolutely not right for our young people. So safe and secure. So like I said, we're going to go into this discovery phase. We're expecting, it depends on legal and where we get with the MOU with UNICEF, but we're expecting that phase to be between April and November. It should be about 6 months. Some people or local authorities that have gone through this process have extended this to as much as 18 months. I don't think we'll need to do that, but it could be that sort of 6 months. So that discovery phase is when we identify the priorities for child friendly that our town want us to work on. I have absolutely no doubt that it will be safe and secure will be one of those priorities. Everywhere that I'm going, safe and secure is being, the number one, sort of area of challenge that our children and young people are throwing at us and concerned about. So I absolutely think that will be one of them. I also, we are working incredibly close with our climate change colleagues and on environment, and the environment issues were coming up. The request for a green space, the request for sort of an area with lack of pollution and with sort of a clean environment to live in was coming through as well. And don't forget the e-scooters. There was one young person that was just adamant to talk about e-scooters. But and safe places to cross. So I wouldn't be surprised if place becomes another one of our the priorities that we start to go down. And I'm really hoping that health might be the other. So thinking about the mental health and the different health issues and how those all massively impact, but we'll need to wait and see. And that's what I was trying to say. So I can't predetermine what that consultation is going to say. I have a good idea what it's likely to say just from other people's surveys as well. And yeah, Lucy, if you can share your Health Watch 2019 survey with me, then perhaps we can put that in the, I don't know what the collective structure is going to look like, but it would be nice to have it somewhere and to be able to access all of that information.
Can I just come back? Yeah, so happy to do that, Lisa. I think for me, from a health and wellbeing board perspective, I think we were listening earlier about the cancer dashboards that Public Health
Yes.
are creating with, and I don't know if that fits into the UNICEF ring. It would be really good to stop going back to past data for me to say in 2018, 2019, we were saying the same things. I think there needs to be sort of a progress next steps on this potentially of this is where we're at. This is the dashboard, and then we can work from those stats going forward. I just wondered if that would be an option.
Yeah, again, you know, and again, until we've identified those priorities, even sort of identifying indicators and our baseline, yes, we can pick up some baseline, and I've already started to create some indicators that we can use as our baseline to show that impact and that improvement. And I've already identified some. We're working closely with Public Health and the SHU survey, so you're probably aware that the SHU survey this year, for the first time, will go to every school and be completed by every one of our children in the schools across Luton. So absolutely great opportunity. So this week I'll be working on what sort of questions we might want to put in, although we're not allowed to adapt it too much, but trying to get what sort of questions that we can start to measure that impact and start to see that difference as well. But I mean, if you have any ideas or thoughts on what those questions ought to be, then yeah, please let me know, because I think, yeah, by the end of this week, I think it's going to start to come to an end and start to go out to schools quite soon. I think it's March, I think, that goes to schools.
Okay, Lucy, yeah. Anybody else? No other questions from anybody? Happy to agree the recommendations.
Yes, thank you.
Thank you very much for the full report. Thank you. Look forward to working with you.
Lovely. Thank you very much. Thank you.
And we move on to item 10 and the population wellbeing strategy. Is that you, Sally?
Yes,
Yeah.
thank you. So first of all, apologies for a revised version going out quite late this afternoon. Myself and the team were looking at some of the data that was, hopefully everyone's got it, the new version. We were looking at some of the data that we'd included yesterday and realised that there was some mismatch on some of the data, and we just tried to get it back through quick enough so that we could present the most accurate data rather than me sort of going through line by line telling you which ones were wrong today. So we thankfully have got a new version. So in your packs, you've got a short version and a longer version, but the longer version is what was sent out, the new version today. And I will just talk through that structure and approach, and then open up for any questions. So this is a 1 year on review of the population wellbeing strategy that we agreed last year. And this is our statutory health and wellbeing, joint health and wellbeing strategy. So it's a system partners health and wellbeing strategy. For us, we call it our population wellbeing strategy, and it is really aligned to our 2040 vision. Is a key driver of our to meet our 2040 ambition. The original strategy was structured around start well, live well, age well, and you'll see as I go through the strategy that I'm sort of proposing moving away from that just to make the governance a bit clearer, not taking away from any of the work programmes that we're planned, but just in terms of how we are showing that structure to stop it being a little bit confusing. I think it was where we were trying to shoehorn things into living well or aging well when they're not such a natural fit. So, but the data that's presented in the strategy, so we've got just that clarity again around what our key issues are that we're trying to solve through this strategy. So what our drivers are in terms of work to focus on, so what the data shows, and then what's our vision to tackle this through the first section of this report. And just recapping on page 10, that visual around the key work programmes that we're saying we're going to deliver as part of this strategy. So some of our strategic system-wide approaches and some of those topic-based issues that we're looking to address, such as mental health, for example. And then from page 11, we're starting to pull together our performance measures. So when we first published this strategy last year, we set out the structure of how we wanted to show progress. But a lot of work was needed to pull together what those indicators would look like according to the different work streams and priorities through the strategy. So the work that's gone into getting it to this point to be able to say these are the key measures that we're going to use for this strategy, it's kind of on a page and looks simple, but there's been a huge amount of work in the background to get it to this point. So all credit to the BI team for helping us with that. So what we're proposing is there's, for each of the strategic boards and the key priority work streams within those boards, we're having high level measures for those work streams. And then underneath, as we mentioned already with the cancer and the mental health, there'll be some more detailed dashboards or progress measures for some of those more detailed work streams. But for each of the boards, we'll have some high level key indicators that will say system wide, we know we're making a difference or not, or need to continue to focus. And as part of that, because through the Health Equity Town Marmot report, there's some key measures that are recommended that we show progress against health equity, we can pull those ones out as well. So within this report for each of the boards, those ones that are Marmot measures as well are in bold. So you can see which ones those are, but the schematic diagram of that is on page 12 to make that clearer. So what we've done through this report is show all of those measures and how we will continue to measure those on an annual basis. So what we've tried to do is show a trend and our comparator. We're basing it on the JSNA data. So where some of them, they're grey from last year, it's because they weren't included in the JSNA. But what we can do is go back through and populate that with the last year's data, because we can still show a trend, but we don't have the data points to pull through from the JSNA at this point. And so then what we've done in this report is where we set out last year the key actions for year one of the strategy. From page 28 of the report onwards, we have gone through each of those key actions that we agreed and showed what work we've done to achieve those. So the progress against those agreed actions previously from last year. So you can see that in terms of deliverables and work underway, we have done an awful lot as a system, which is really positive. And then what the report then shows is what our refreshed action plan for 24-25 looks like. So across the boards, how we're going to deliver against our new renewed focused actions. And there's a schematic governance diagram to show how the three boards that are sub-boards of this, Health and Wellbeing Board, so Children's Trust Board, Health Equity Town Partnership and the Place Board, feed in and drive forward those actions. And then what's also connected in that governance structure is our Health Protection Committee, where we have the oversight of the infectious diseases works, sexual health, TB, flu, COVID, etc., sits under there, and some of the key work streams as part of the community safety partnership that sit within the population wellbeing strategy. So drug and alcohol, on-street sex work, domestic abuse all sit within that as well. So we'll be reporting through this population wellbeing strategy through those boards as well. So I'll stop there and open up to any questions. So I appreciate there's a lot of information in there, but hopefully it's a useful point in time around progress against the strategy.
Thank you, Sally. Any questions? No questions from anybody? Robin?
Yeah, just I feel like I need to just make the statement that, you know, we look across the 2040 agenda. Some colleagues that were in the room last Friday will have heard this, others that won't. So I'll just very quickly, you know, if you look across the agenda, we're making some very, very strong progress. Luton was the #1 place in the country from 2010 to 2022 for private sector job creation. That's ahead of London as a whole. As a place, our carbon output is 2/3 of the national average, and it's reducing on 3% year on year. So we're clearly on track to make progress on certain of our 2040 measures. For population wellbeing, I think collectively, we just need to look ourselves in the mirror. I think there's more that we need to be doing. We're not making the progress that we need to be delivering our 2040 strategy. So I think it's beholden on us all to be doubling down. There are some measures that are going well, and we've already talked about cancer progress, but a lot of the measures aren't heading in the right direction quickly enough. Thanks, Chair.
Thank you very much. Anybody else? Yes, Bill.
Last Friday, there was lots of very, very positive statistics came out on the improvements and how people felt and all the rest of it. I just feel that that needs to be visible somehow or other to the general population of Luton, because I think I said a long time ago, success builds success, and if people can see that things are happening, then I think that will help the momentum. I'm not quite sure how we do that, but I really do think that would help.
You're absolutely right, and it's incremental. We launched the back end of last year, middle of last year, our new place brand, Step Forward Luton, which is collaborative, system-wide approach to repositioning in people's minds. A couple of weeks back, we got Radio 1 Big Weekend. That is absolutely massive for our national reputation. But you're absolutely right. Culturally, as a place, we've got lots of strengths, but one of our weaknesses as a place, and I'm talking about as a town, is we're self-effacing. We don't shout enough about what we're doing well, and we need to get better at that as a place. And part of the agenda for me last Friday was actually starting to shout about what we're doing well, because it was a really positive event with lots and lots of positives across the whole of the Luton system.
Can I just come back on that?
Yes.
A long time ago, I saw an AV of the concept of the new stadium and that area and Power Court and all the rest of it, which I thought was brilliant. Now, there was some still images of that on last Friday. I just think something like that running in the Mall, on the screens in the Mall, would be brilliant for people to have a vision of what it's all going to be like.
And I'm sure as soon as the football clubs get to the point where their design is settled, I'm sure they'll be more than happy to be out shouting about what they want to submit to the planning authority for the planning authority to consider.
Nina.
Thank you. So the health and wellbeing strategy we were talking about at the place board earlier on today, and one of the things that I think was important to bring out was how do we get others to know a little bit more about the progress that's been made and other things for the future. So I like the idea of that sort of readily accessible imaging and information, and where people are. Where do people gather? Where do they see things? Where are they as a workforce? Where do workforces come together and different types of workforces? And the health workforce is massive, and many are residents in the town. So actually using all the opportunities we can, and perhaps taking subsections of information that influences in that particular arena. So something that people are interested in, but actually some others that they think they're not interested in, but would be really good to know. So I think there is something that we could do there, and that's something for all of us to take back, really. In our organisations, in the context we have, what are those connections and what could we utilise there? So yeah, I think it needs more. It needs wider dissemination so that people who are public facing have some of those concepts and aren't perpetuating the negatives. Actually, they can see the positives.
I think that's very useful. Mark?
Just a couple of points for me, Hazel. One, I completely agree with Robin. Actually, the direction of travel, it's worrying when you look through the dashboard as much as anything else. But what we do know is that's not down to a lack of hard effort and application, without a shadow of a doubt. What I do think we have to be minded about is the challenges our borough faces, and in the right context as well. There was a report from the Joseph Rowntree Trust about levels of destitution nationally. We were previously 61st most challenged, we're now 10th, which is really quite alarming in the context of structural inequality and the impact that means for people as well. And as some of our demand services, our housing issues where we are, that is really undermining all of the other things that we're doing around it. And at the top of that, so actually that has to be a real precise focus on what we're doing and how we're executing against all of 2040. Because Robin's right, again, the number of jobs we're getting through is brilliant and comparable, but how do we know those jobs are going to the right people? how do we give people the best housing options as well within that, so they can stay in the borough, spend their money in the borough, and then that starts to shift over time, doesn't it? And I'm genuinely very worried the consequences of COVID and actually the cost of living sort of manifest in somewhere like Luton and what that means for us, because we're going to live those experiences now. And actually, I'm sure Raj would attest to, I know if Jill was here, she would as well, the demand in our care services is escalating at an alarming rate. So how we all come together as a system is absolutely paramount to move that dashboard in the right area completely.
I think that's a very important point also, the level of pay for the jobs that are being created. Because if it's all minimum wage, then that isn't going to ever lift anybody out of poverty. And so the focus on skills and developing communities is really, really vital as well. Yeah. Are there any other questions of Sally? Yes.
Hi, Sally. Yes, you classified 3 stages of life course: starting well, living well, and aging well. In the living well, I know you are doing some health and well-being activities through the Active Luton. Do you consider to add oral health, because this in Luton, dentist is a big problem. I've seen you are doing with the oral health screening for the children starting well. In the living well to the Luton Active Luton scheme, do you have any plan to consider for oral health screening service? That will be very much helpful, because at the moment, like, people are struggling to get a NHS appointment, and the private dentist, they are not accepting any patient. Thank you.
Thank you. So the work from the public health side that we're coordinating in terms of our action plan is largely focused on young people and prevention, and that sort of health promotion approach. So we've been doing a whole lot of work around the dental pop-ups that we've been doing, and going out to schools and doing fluoride varnish, and supervised toothbrushing and distribution of toothbrushes to parents that come into the pop-ups. And so that kind of approach is what we've been focusing on from a public health perspective, because we know that our 0 to 5 stats for called DMFT, so decayed, missing or filled teeth, is really high. There's a really high proportion of under 5s that have decayed, missing or filled teeth, and the stats for hospital admissions for oral health for young people aren't great either. So that's from a public health perspective where we've been focusing. The dental access point, I know, is something that is a key worry for people in the community at the moment, and there is work underway around that, and I will hand over to Nikki just to answer that, because I know we talk about it and we're trying to work through, and the work that I've just spoken about around that oral health plan is not, it's aligned and we're part of the same project, but the commissioning of the dental services sits with Nikki, so I will hand over.
Yeah, hi. So just to put that into context, Robin earlier mentioned about the pledge, and that is one of those areas we've put in about access, particularly children. So just so everyone's aware, it's almost a year that the ICB took over accountability for commissioning dental services. So we've been really clear, it's that year dental contracts have been agreed by the previous commissioner, which was NHS England, but we've worked quite, I would say, in partnership, certainly with public health teams, to increase that access, particularly to children. I mean, just as an example, it's about how we dovetail together to make sure that we do the signposting. So I've got a bit of a briefing because I know Councillor Malik wanted to know a bit more. Now, just because it was very topical, it was only on the 7th, the new Secretary for State announced some flexibilities in dentistry. I genuinely can tell you that what we were doing is nothing new. The real absolute fact of the matter is that we haven't got a very good contract, national contract. So we've worked very closely with our dental contractors. Is that at the moment it can cost a dental practitioner more than they earn the way the contracts worked. So we're working in a very flexible way but it's not easy. So we've got absolute commitment, and outside this meeting I can go through a bit more, and I know Councillor Malik wants to know a bit more about it, but we're doing what we can, but we will help to signpost children to find dentists, and there is the capacity. But as you quite rightly say, it's an issue not just for Luton, it's a national issue.
Can I just say that through the pop-ups, we managed to get, I haven't got the exact figures, but it was a large amount of children that we got registered. We actually did get some adults that got registered as well. So that was an amazing piece of work that we did with the pop-up. So we know that there's a need there, but there was a large amount of children that we did get registered.
Sorry, just to come in also. So we've mentioned already that some of us are at the Family Hub's launch today. So it's a new model, a new approach to family services in Luton, and absolutely connected to the oral health agenda and that the pop-ups work and building in that health promotion and wrapping around services around the family as part of that. So all of these sort of public health issues, connecting health and care services around the family, that Family Hubs model is going to really strengthen that approach. So the launch was today, but we can only sort of build on all of these issues that we've been talking about today through that model. So that's really positive as well.
Can I just ask, the health hub in the Mall seems to have closed. Is that true?
Where we had the COVID vaccinations,
The old post office, yeah.
Yes. So that we opened that as part of our COVID vaccination outreach offer, and we were really working on building it to be a wellbeing hub. So we had lots of other services in there. We had social prescribers in there. We were trying to do other vaccination offers in there as well. We had MMR in there for a while. And we were trying to keep that open to build on that. And we have had to close it for contractual reasons related to the estates, etc. in the mall. So it's closed at the moment. We were looking at whether we could then reopen it and rebrand it as either part of Family Hubs or build on that approach as a wellbeing hub. We haven't been able to do that at the moment. We're now looking at Central Library, which is obviously just around the corner. So we're working on it, but it has closed yet, which is unfortunate because we were really hoping to have that continuity. And it's not necessarily closed forever, but at the moment we've closed it.
It almost gives the wrong message because it's there, it's now empty, and it's got a big sign on it which says health hub, but it's deserted. But it just gives the wrong message to people walking by it.
I know, and we were really conscious of that, and we're pushing to keep it open, and really recognising as well that often these things take a while to get going, and you build that trust, and then so it's not ideal. I completely agree with you, but.
Okay, I think we're asked to note the wellbeing strategy. Yeah, okay, and take note of some of the issues that are in it. Come back in the future. Yeah. We move on to item 11 and BLMK integrated report. Is that yourself?
Yeah. Yes. Okay. The paper's actually for noting, but it's also asking a question, but I'll pick up the points and then I'll come back to what we're asking the board to agree. So we had a last board meeting in December. You'll note that we always have a patient story to try and keep it grounded. And I think that's really, really important. And that particular story was revisiting it, emphasising what I call a more personalised approach, which was a particular resident with, chronic back pain. But the forward plan, it came to this meeting previously. There is not an expectation that it will be rapidly changed because we only produced that back in June. But one of the questions or an ask of this committee is that if there is any considerable change, that it will actually go to Hazel as the chair, and it's only because of timings and it will come back. At the moment, we don't anticipate anything, that is there is not an anticipation of anything, but it is important that it's about mapping that financial budgets along with the planned activity, along with the workforce. And if anyone wants that plan again, we can recirculate it. At the board, there was quite a focus on the Denny review, which I know you've received, and very much looking at those 9 recommendations. And I know that all organisations have signed up to work collaboratively. We also have a board member sponsor, that's the Chief Exec of East London Foundation Trust, and that is just so we've got somebody to champion that report. I think apart from anything else is that some of it is hard reading and it is across the system, and it will require all of us to work in that very I think it's what Mark said, you've got to be proactive and you've got to recognise the difficulties but work towards it. There was a agreement for a system-wide translation service because language barriers was something that came up quite starkly. I mean, it is, as I say to you, is that if you look at the NHS app, there isn't much translation in there at all. So some of the basics are really not in place. So that was one of the system-wide commitments. And there was also an agreement that there will be a minimum of an annual review of that, of those 9 recommendations, and very much to track the trust and the impact. And I think, Councillor Malik, you mentioned that a couple of meetings ago. How do we know if we're making any progress? So there's a very clear action plan to be able to share that with you. Equally, there was an item on the recovery access to primary care, and that is very much of primary medical services. And I know I've got Councillor Underwood here, and quite rightly, the Overview and Scrutiny Committee look at that. So there is a large amount of work taking place, and Nina being one of the primary care networks with the primary care networks. And part of that is that system approach, because it isn't just about the practices, and I'm looking at colleagues in Health Watch. So that are part of, we have a multi-agency meeting that's called the Primary Care Delivery Group, and we have another one that's the Assurance Group, that's a subcommittee of the board. So at this particular meeting, it gave that high level update. And I think the other important thing, and with Liz and with James, so it's quite useful, it was one of the focused areas was about trying to reduce the bureaucracy, and that is very much about improved systems workings. So we had some real evidence of practices using a lot of time dealing with patients that were concerned, and we all know the waiting list, they're no fault of anyone's, but it's actually how do we get a slicker system so that people can navigate their way through. And Liz, you may pick up, because we've got some quite innovative approaches across the system, but that is one of the areas that came up in the board. What's important, and this is something certainly that Phil mentions all the time, what are we doing and learning from different areas? So Milton Keynes presented some work they've done with a company called Carnell Farrer, and that was very much about what they call the Milton Keynes deal, and that is that integrated neighbourhood working, which I know we're doing in Luton, but there were some lessons to learn from that. Another area that's quite important is something called the provider selection regime, which it did go through and it is now law because it went through on the 1st of January. So these are new rules for procuring, and that is left to our subject matter experts, but it's something we all just need to be mindful of. And particularly, I know that Sally and myself and also Jill, where we're doing some joint commissioning. So that's information's there. If you want any more, I can go through. And then the other part of the meeting is clearly in the board is making sure we've got performance ratings and also looking at the budget. So that's quality, performance and finance. Also, we reflected on the early years seminar that we had back in November, and having been today at the launch of the family care at the family hubs, it's really important that we're talking all age, because I know it's something we get concerned about, that children can get missed where it actually becomes a bit adult dominated. So in the early years seminar, there was a lot of delegates and probably people in this room, and that was very, very much all what was talked about today as I say, at the launch of the family hubs. It's about how we keep the children at the centre, and it goes back again to that pledge that Robin mentioned about elements to children. Also quite a lot about helping to address children with mental health, and more to the point, preventing it. And that's again what we spoke about today at the family care hubs. So that's an overview. So if I just go back just to make sure, Chair, that if there is anything, we'll, if that's acceptable, to seek your authorisation, and then of course we'll bring it back to the board at the next health and wellbeing session.
Are there any questions first of the report? Oh, is everybody okay if I'm asked if there's any alterations to the paperwork before it goes in? Is that acceptable to everyone? Okay, thank you very much. Are we happy to approve the report? Thank you very much. And I believe now we're on to the draft work programme. Happy to take any issues. Have you any issues to raise here? The work programme?
Chair, I just wondered if you wanted to have Luton 2040 in next year's work programme from June onwards, perhaps
I think
June.
that would be good if we had an update. Do you? On Luton 2040? Yeah. Okay.
Thank you, Chair.
Okay, unless there's any questions or anything on the work programme, I'm assuming that's accepted. That brings us to the end of our meeting tonight, so thank you very much, and a lot of information imparted this evening. I think a lot of real serious important information we've talked about tonight, very important. So thank you for your contributions, everybody. Thank you.
Thank you. Thank you. Good night.
Thank you. Good night.